Welcome back to my channel. And if you are visiting this channel for the first time, you are also highly welcome. In this lecture, we'll be looking at the common iliac artery. Let's try and use this image by the side to illustrate and also establish how the common iliac artery emerges. This image here that is highlighted in red is the abdominal aorta. So at this point, we have the right common iliac artery on the right, just as the name implies, and we also have the left common iliac artery on the left, just as the name implies. This name, common iliac, is so drafted because this artery would be further subdividing into the internal and the external iliac artery, which means that this common iliac artery is common to both the internal and also the external iliac artery. So at this end here, you have the right common iliac artery dividing into the external iliac artery and also the internal iliac artery. As you have this presentation on this side, you also have on the other side. So we say that the name, the common iliac artery, is drafted because there is a further subdivision of this artery. And of course, they will be further subdividing into the internal and the external iliac artery. And this is how we have the emergence of the name common iliac artery. So in this lecture, we'll be looking at the morphology of the common iliac artery, establishing and also the structures that are related to the common iliac artery. The common iliac artery is paired terminal branches of the abdominal aorta. We've tried to illustrate this in our previous slide. If you try to use this image here, we already said that this is the abdominal aorta here, highlighted in red. And we said that the abdominal aorta is located within the abdominal cavity. And this is what is seen to be carried here in red. At this level that is demarcated in dotted black, we see that this abdominal aorta will further subdivide into the right common iliac and the left common iliac. And this level, we say tallies with the fourth lumbar vertebra. So at this level where they emerge, you see that they tend to run inferior laterally. So after the bifurcation of the abdominal aorta, dividing into the right and the left common iliac artery, you see that the path that these two arteries run is directed towards the inferior lateral region. So they tend to divert and run inferior laterally. And if you look at this image, up here is where we have the abdominal cavity. Inferior to the abdominal cavity, we have the pelvic cavity. And at this inferior region here, you have the lower limb. And this is the lower limb here at this region. Remember, we said that this common iliac artery will further subdivide into the internal and the external iliac artery. The external iliac artery will be directed towards the lower limbs, where it will be supplying structures within that region. And while the internal iliac will be directed into the pelvic cavity, where it will be supplying structures that are located within the space. So you see that the common iliac artery will give supply to both the pelvic cavity and also the lower limb. It's also good for us to add that the common iliac artery usually ranges from between 4 to 5 centimeters. So after running this course, it's when they are now seen to finally terminate into the internal and external iliac artery, which will supply the pelvic cavity and also the lower limb. This is where we say we have the common iliac artery on the right. And as we have it on the right here, we also have it on the left. And if you see that after they emerge from the abdominal aorta, they tend to run inferior laterally, as we described in our previous slide. And as they run inferior laterally, you see that they are directed to the point where we have the sacroiliac joint. This is where we have the sacroiliac joint here, arrowed in blue. The sacroiliac joint is the joint that is seen between the sacrum and also the ilium. So at this point is where we have the direction of the common iliac artery after its emergence from the abdominal aorta. We also know that this alignment also falls along the path where we have the pelvic brim or the pelvic inlet. And this is what is highlighted here in yellow. This pelvic brim or pelvic inlet, when we try to describe the structural orientation of the pelvic brim or the pelvic inlet in our previous lecture on the pelvic inlet, we described in that lecture that the sacroiliac joint also forms the posterior alignment of the circumference of the pelvic inlet. So if you look behind here, you have the sacroiliac joint. And at this alignment where you have the pelvic inlet or the pelvic brim, you then see the common iliac artery finally subdividing into the internal iliac artery. And this is what is seen at this other region, and also the external iliac artery, which is also seen at this other region. So you see that as you have this subdivision on this side, you also have it on the other side. So finally, the aim or the target of the common iliac artery, as so named as common, is to finally divide into the internal and the external iliac artery, where they will be taking their respective regions in the pelvic cavity and also the lower limb, where they will be supplying structures that are located within the space. Let's use this slide to illustrate the differences between the right and the left common iliac arteries. There are differences between the right and the left common iliac arteries, especially in terms of their length and also how they are positioned around the common iliac veins. We know we have a corresponding named vein, which is the common iliac vein that is seen to run along with the common iliac artery. So if you look at this image, this is where we say we have the abdominal aorta. The abdominal aorta, the way it is positioned along the midline plane, you see that it is directed to the left. So the direction of the abdominal aorta is more tilted towards the left. So you see that the abdominal aorta is already tilted towards the left. If you use this line that is demarcated here in dotted brown as a course that runs along the midline plane. So because you have the direction of the abdominal aorta more tilted to the left, the emergence, which are the common iliac arteries that will be seen around the region where it's bifurcate, we also have differences in terms of their length. So this is the right common iliac artery, and this is the left common iliac artery. You see that the right common iliac artery is approximately 1 centimeter longer than the left common iliac artery, and this is understandable. If you look at the abdominal aorta, we say it's already tilted towards the left, and if you see how the left common iliac artery emerges, you see that it is shorter in terms of length, and it is shorter so as not to go out of space, because if it is longer around this space, it is going to be extending out of the pelvic region. And for it to be contained within this space, it needs to be shorter so as to accommodate itself within this region. So you see that the right common iliac artery is longer in terms of length than the left common iliac artery. And this is understandable, as we've been able to justify this based on the position of the abdominal aorta that is tilted towards the left. And if you go to the other region here on the right side is where we have the inferior vena cava. And this is what is seen to be highlighted here in blue. The inferior vena cava is what drains deoxygenated blood back into the heart. And if you look at the way it is positioned, you see that it is located on the right side of the abdominal aorta. And because of this position, you have the corresponding named veins, which are the common iliac veins on the right and on the left, also draining deoxygenated blood into the inferior vena cava. And if you look at the length of these two veins, you see that they are also different on both the right and also on the left. So at this region, you have the right common iliac vein here, and on the left here, you have the left common iliac vein. And these structures here are seen to be highlighted here in blue. So if you look at the length of these two veins, you see that on the left common iliac vein is longer than the right common iliac vein. And this is also justified based on the position of the inferior vena cava that they will be draining into. If you look at the inferior vena cava, we already said that they are positioned on the right side. And if you look at the left common iliac vein here on this side, you see that it is longer. And it has to be longer because of the position of the vein that it will be draining into. So it needs to extend more so as to be able to reach or also accommodate itself within this space. And if you look at the right common iliac vein, you see that it is shorter, and it has to be short because it does not need to run a long course for it to be accommodated within this space, so as not to also get out of space. So you see that the length of the common iliac arteries on both the right and the left, and also the common iliac veins on both the right and the left, are also different. The lengths are inversely related. So if you look at on the right, you see that the common iliac artery on the right is longer, while the common iliac vein on the right is shorter. If you go to the left side, the left common iliac artery on the left is shorter, while the left common iliac vein is longer. This is attributed to the position of both the abdominal aorta and also the inferior vena cava. So they need adjustments in their length so that they can fully be accommodated within that space, and also to prevent them from going out of space. And this is attributed to the fact that the abdominal aorta and the inferior vena cava are positioned along different planes. So if you look at on the right side, you see that the right common iliac artery is seen to cross anteriorly over the right common iliac vein. This is the right common iliac vein here, harrowed here in blue. And if you look at the right common iliac artery on top here, you see that it is seen to cross anteriorly over the right common iliac vein. So this is the kind of presentation that is exhibited on the right side. While if you go on the left side, this is where we have the left common iliac vein here that is also harrowed in blue. You see that the left common iliac vein is seen to be located along the medial side of the left common iliac artery. This is where we have the left common iliac artery, and this is where we have the left common iliac vein. So you see the left common iliac artery located on the lateral side of the left common iliac vein on the left side. And this is what is presented. So you see that the orientation that they have or their placement around the common iliac vein is different. And we've tried to justify why there are differences in terms of how they are placed and also in terms of their lengths. It's also good for us to add that we have the emergence of the median sacral artery. This median sacral artery is seen as an emergence from the posterior region of where we have the bifurcation of the abdominal aorta. If you look at this image by the side, we say that we have the abdominal aorta here, and at this level that tallies with the fourth lumbar vertebra is where they are seen to bifurcate into the right and the left common iliac arteries. At the posterior aspect or region of the point where we have this bifurcation, we have the emergence of the median sacral artery. And this is what is highlighted here at this point. This median sacral artery, from the name median, it means its emergence is along the midline plane, and sacral because it's directed towards the sacrum. And of course, it is an artery. So we have this median sacral artery, of course, providing oxygen and nutrients to structures that are located around this region, including the sacrum and also the coccyx. So this is another emergence that is important for us to highlight around the bifurcation of the aorta. So let's drive through to establish the relations of the common iliac arteries. But before we dive into this, it's good for us to recap or refresh on the relationship that the common iliac arteries on the right and the left, of course, have with the common iliac veins. We already established this in our previous slide. If you look at this image down here, we have the common iliac artery on the right side crossing over anteriorly on the common iliac vein. Where on the left side, we have the common iliac artery positioned on the lateral side of the common iliac vein. We already established the basis behind this establishment. If we consider the position of the abdominal aorta, we say that the abdominal aorta is directed more to the left, and we also have the inferior vena cava located on the right side of the abdominal aorta. So all these factors are seen to contribute to the orientation that the common iliac artery has on the common iliac vein on both the right side and also on the left side. So let's drive further to see the structures that are located anteriorly. So anteriorly, we have the ureter. The ureter is what is seen to be highlighted here in green, and it is seen to be positioned anteriorly over the common iliac artery. So you have this presentation here on this side, and you also have it on the other side. We know that the ureter is a connection between the kidney and also the urinary bladder. So we have the kidney up here highlighted in blue, and inferiorly within the pelvic cavity, we have the urinary bladder. The urine that is produced in the kidney is transported through the ureter, where it will be stored temporarily in the urinary bladder. So along this course, you see the ureter related to the common iliac artery anteriorly. So this is how it runs, and you see it as an anterior relation of the common iliac artery on both the right and also on the left. And if you look at the ureter here, it is positioned specifically at the region where the common iliac artery is bifurcating into the internal and the external iliac artery. And this is what you have here at this point. You can see that we have the common iliac artery here, and you see it bifurcating or dividing into the internal and the external iliac artery. And at this point here, you see that it is at this specific region that the ureter is seen to be related anteriorly to the common iliac artery. Then another structure that we have that is peculiar to the left common iliac artery is the superior rectal artery. We have the superior rectal artery here as an emergence from the inferior mesenteric artery. So after it emerges from the inferior mesenteric artery, you see it descending down where it will be supplying the rectum. And along this course, you see that it is related anteriorly to the left common iliac artery. This emergence is not seen on the right side. This is distinct for just the left common iliac artery. Then posteriorly, the structure that you have behind, we already established that we have the sacroiliac joint. We have the sacroiliac joint here, arrowed in red. The sacroiliac joint, we already established that is the joint that exists between the ilium and also the sacrum. So at this point, you see that this joint and also its supporting ligament are seen to be related posteriorly to the common iliac artery. Then another structure that we have around this region is the psoas major muscle. This is where we have the orientation of the psoas major muscle here, highlighted in dotted yellow. This psoas major muscle is seen to originate from the lateral regions of the vertebral column. As it emerges from the lower vertebral region, you see it descending where it will finally be inserted on the truncator of the femur. So along this course, you also see it has a posterior relation of the common iliac artery. So these are the structures that are related to the common iliac artery. And we've tried to illustrate this, also establishing the specific regions where they are located. So let's look at clinical anatomy. And the clinical anatomy I would want to highlight is aneurysm. Aneurysm is bulging of the wall of the artery. So where you have an enlargement leading to a ballooning feature or characteristics of the wall of the common iliac artery, this is what is presented here in this image, and this is what is referred to aneurysm. Aneurysm can rupture and can lead to internal bleeding. Thanks for watching this video. Let's continue to stay glued to this channel.